Thank you, James. Good morning, everybody. So One Health approaches emphasize collaboration across sectors, agencies, professions, disciplines. The diagram that James discussed presents a systems framework for the study of zoonotic disease emergence, a holistic conceptualization of all the interactions at play across different scales. Now, my slide shows another visualization of this kind, this one from the Dynamic Drivers of Disease in Africa project. Now, these interrelationships are poorly characterized. And James has argued that to understand them in an integrated manner requires an approach that combines multiple disciplines. And I want to focus further on this idea of interdisciplinary collaboration. So I'm a human medic with training in anthropology. And arguably, social science perspectives have been less appreciated in One Health research. And as social scientists, we're interested in the local, social, ecological, and livelihood contexts of human-animal interactions. However, as James described, we also pay attention to wider drivers, the structural determinants of disease vulnerability, and also the political dynamics at the science policy interface. So let me share an illustrative example from an interdisciplinary One Health project that I've been involved in a context characterized by great political instability and rapid social change. The Myanmar Pig Partnership is concerned with livestock intensification and transmission of foodborne zoonoses, funded by the BBSRC ZEL scheme and led by Dan Tucker at Cambridge. In our project, laboratory science is focused on the prevalence of pathogens, Strep suis, Salmonella, E. coli, and also detecting resistance to antimicrobials. Veterinary surveys have mapped production practices and antimicrobial use. Agricultural economics has examined the value chains for pig products in Myanmar and factors influencing adherence to biosecurity measures. And anthropological fieldwork has explored the value of pig farming in local livelihood systems and where farmers turn when pigs fall sick. Then our integrated analysis is focused on mapping the risks to human and animal health across the different pig production types that we've identified. Now, in terms of policy responses, standard interventions proposed to address health risks tend to focus on the behavior of farmers, such as trying to promote investment in biosecurity or antibiotic stewardship. It's clear from our research that many factors constrain farmers' agency to change behaviors in this setting. If we consider the small-scale backyard farms, the highly precarious nature of livelihoods has been very evident. For example, with an absence of low-interest loan schemes, pigs tend to be kept as a form of financial insurance to sell for quick cash. Furthermore, farmers have limited access to formal veterinary expertise. The loss of a pig from disease is feared, and antibiotics, often purchased informally, are valued as a way to mitigate this risk. So attention to the wider socioeconomic and healthcare context thus enables an understanding of why behavioral change is hard to achieve. Policy aimed at improving human and animal health, or policies oriented towards pathways of greater intensification of pig production, thus need to take account of several trade-offs. Our research has also brought home the importance of considering the life worlds of farmers themselves, and this points to the really unruly and uncertain nature of these multi-scalar dynamics that need to be taken account of. So here I want to make a case for the importance of social and systemic perspectives in One Health research, not just as an interesting added extra, but essential for the design and implementation of effective One Health policy and practice. Firstly, social contexts influence the immediate scale of human-animal interactions. In anthropology, there's increased theoretical interest in human-animal ecosystem relations in different settings, including worldviews that understand the place of the human species in more integral and equal relations with these in their environment. And these alternative perspectives are informing thinking about the Anthropocene, planetary health, and more sustainable futures. Secondly, I've stressed the importance of attention to political economic structures which mediate power relations, policy responses, and vulnerabilities to disease. And finally, I want to propose that we need to get beyond the idea of social and biological research in separate silos, the bio plus the social that might or might not get added together. An integrative analysis requires more sophisticated conceptual work. And in medical anthropology, there's considerable interest in an integrated biosocial conceptualization that also appreciates how the social environmental can act to shape biological outcomes. And thought about how social and biological processes are interconnected has been advanced in particular in research on neuroscience and epigenetics. And in these fields, as I'm sure you're aware, the biological is understood to take on meaning also in relation to social experiences and environmental exposures. So I propose that a similar conceptual shift is needed to take our understanding of One Health dynamics to a new level. For example, in understanding how social and structural conditions come to shape biological vulnerabilities. And what has, of course, become abundantly clear during COVID-19 is that these relationships remain poorly understood. And the inequality virus, as an Oxfam report put it, really shows us that these interconnected dynamics demand attention as an imperative for social justice in health. And similarly, a rethinking of pandemic preparedness needs to pay attention to addressing spillover at the micro level, but also to the structural factors that can enable more effective systems for surveillance and disease detection. So in the urgency of this pandemic moment, it's important that we continue to push forward with forging interdisciplinary perspectives and that we don't retreat into our silos. And more than ever, we need this integrative thinking and action and effective collaborations to achieve this. And I'm really pleased that the new coronavirus network might advance this cause. Thank you.